who is taking medications either temporarily or long-term, and you're breastfeeding or expressing breast milk for your infant. How do you know if those medications are safe or if there's a way to time the medicines if it does go into the milk? So let's talk a little bit about that. The way that a parent can look up whether a medicine is safe in breast milk or not, there's two ways to do it. One is by the resource LACTMed, LACTMED. So that is it's run by the National Library of Medicine, and you can type in the medication that you're taking, and you will get a paragraph that will list information about its safety and whether a breastfeeding mother should take it, and if it's safe for the baby. A more simple way to check it that has fewer words and actually has a rating scale, which I find very handy, is through Dr. Thomas Hales. He has an infant risk hotline and a website, a book, and 2 phone apps. The phone app for parents is called Mommy Meds, and the phone app for doctors and other providers is called Infant Risk. A parent could actually download either one. It's just that the Infant Risk one is a little bit more expensive. The book, I would not recommend that any parent purchase the book. It's way too comprehensive for a parent, but most doctors' offices do have either that book on site or the phone app. OBGYNs, family medicine, lots of different doctors' offices will need to know if medications are safe in breast milk since they're the ones prescribing. However, what I find in real life is that most people don't look it up. Most doctors don't look it up, and even some pharmacies have rating scales that are not consistent with current data. And so many women are told to pump and dump. And I want this phrase to go completely away. And I'm ready for us to be smart, look these medicines up, because the vast majority of medicines are safe in breast milk. So if someone tells you that your medicine that you're taking is not safe in breast milk or tells you to throw your milk away, I would first stop and pause and ask if they've used one of those 2 resources to look up its safety. What I find commonly is that a pharmacist or an urgent care provider who's not very familiar with breastfeeding will think of the breast as if it is a placenta. So they will look up whether a medicine is safe in pregnancy, and they will say, oh, if it's safe in pregnancy, then it's safe in breastfeeding, or vice versa. And we know that those are completely different organs. So the breastfeeding classifications are L1 through L5, and those go along with Dr. Thomas Hale's Infant Risk Hotline. If you're taking an herb or an over-the-counter supplement, you most likely will have to call yourself the Infant Risk Hotline, which we can make sure you have that number. And you'll need to let them know the manufacturer and the ingredients that are in there. Some of the factors that influence whether a medicine is safe have to do with the age of the baby, how much the baby weighs, the dose that the mother is taking, and how much of that medicine is bound to proteins or bound to fat. And all of that information is actually known for most medications. So please, before you hear that horrible phrase to pump and dump, know that the vast majority of the time you do not need to do that. Let's stop and look it up and talk about alternatives. Talk about alternative dosing. Why is this? If it truly is a medicine that is not safe in breastfeeding, is there not any other alternative? Because the risk to the baby for not receiving the breast milk because the mother is on a medicine might be higher than the risk of the medicine in the milk. Very often, the medicine that is in the milk is one that we would prescribe to infants directly, and so we know that those would be safe. Amoxicillin is a good example. So if a mother is taking amoxicillin, we prescribe that medication for infants and children routinely for ear infections. So we know that safety is really not an issue. Maybe side effects are, but that can be managed with good counseling. So take some of your own health history in your own hands if you need to look things up online.